Bismillahirrahmanirrahim. I am Dr. Mohibullah Wazir. The topic is the ribs. Look, there are 12 pairs of ribs. Sometimes maybe 13 if present only in 1% of people. It is present over here a small rib, that is cervical rib. Otherwise 12 on the right and 12 on the left. Out of these, the upper 7 vertebrae, 7 ribs, it articulate with the sternum directly through the costal cartilage. That's why the upper 7 ribs are called as true ribs. Then the 8th, 9th and 10th, they do not articulate directly with the sternum, but the 8th articulate with the 7th, the 9th with the 8th, and the 10th with the 9th. In this way, this costal margin is being formed, and these articulate indirectly through the 7th with the sternum. That's why these 3 ribs, that is 8th, 9th and 10th, they are called as false ribs, while the 11th and 12th, they do not articulate with the sternum. These are called as floating ribs. Okay, then the ribs are divided into 2 classes, typical and atypical, depending upon the structure. Now the ribs from third to ninth, the ribs from 3rd to 9th, these all have one special characteristics, and this is why the ribs from 3rd to 9th, these are called as typical ribs, while rib 1, rib 2, and then rib 10 and rib 11 and 12, the last 3 and the first 2, these are called as atypical ribs. First we describe the characteristics of the typical rib. The typical rib consists of, look, the head and then the neck and tubercle and the shaft. Look at the head. The head articulate posteriorly with the vertebrae, and each head of a typical rib, it have 2 facets, the upper facet and the lower facet, separated from one another by a ridge. The upper facet articulate with the facet on the lower part of the vertebra, thoracic vertebra above, while the lower facet articulate with its own vertebra. Look, each thoracic vertebra at its lateral side is having 2 facets. Upper facet for its the rib of its own, while the lower facet of the above vertebra, it articulates with the upper facet of the rib below. Then, while this ridge, it is in contact with the intervertebral disc. And then you can see over here, this is the neck, which is a narrow part, and this narrow part, the neck, it unites the head with the tubercle. And then look at the tubercle of the rib. This tubercle is having 2 facets. Look, one is this facet, the medial one. This is the, look, this is like this. This is the medial one, and this medial facet, it articulate with an articular facet at the transverse process of its own vertebra, while this lateral facet is rough, as you can see, and it is non-articular. It is for attachment of the ligament. In this way, each rib make 3 joints at the one facet with the transverse process of the vertebra of its own, and 1 joint with the at the lower facet with the vertebra of its own, while 1 joint with the facet of the vertebra above. And then if you look, then the rib is being bent over here. Look, this bend is called as angle of the rib. And then look at the shaft, it is curved, and it is having this upper border and the lower border. the outer surface and the inner surface. You can see the upper border is rounded, while the lower border you can see it is sharp. And then the outer surface is convex and the inner surface is concave. And at the inner surface, you look typical this groove. This groove is called as the costal groove, and this costal groove, it contains over here the intercostal vein, then artery and nerve. In this order, from above downward, from superior to inferior. First is the intercostal vein, then the intercostal artery, and then most inferiorly the intercostal nerve. This contain, and then look at the anterior end. The anterior end of each rib is rough, and it is for articulation with the costal cartilage, and through the costal cartilage it articulates with the sternum. These are the characteristics of the typical rib, and the typical ribs are from 3rd to 9th ribs. Okay, then the atypical ribs I will discuss in the next lecture. Thank you.